All right, welcome everyone to the final webinar in our ACEs webinar series of 2026. This one is on effects of ACEs on early relational health and clinical considerations and is in collaboration with Reach Out and Read Illinois and Reach Out and Read Midwest, where our speaker is from. Next slide. So this webinar is accredited for CME. This is the statement stating that it's worth 1 credit hour. Next slide. This is the CME financial disclosure grid, just showing anyone that was involved in either the planning or development of the slides and no relevant financial relations. Next slide. So these are some of our additional upcoming ICAAP events. So we have a webinar actually 2 days on supporting mental health needs of LGBTQ youth, refugee, immigrant, child health initiative presentation next week, Safe Sleep webinar later in April, an in-person pediatric mental health conference in Peoria, Illinois in May, and then the next Reach Out and Read webinar on May 11th. And you can always find all of our events on illinoisaap.org/events. I'll put that link in the chat as well. Next slide. So with that, I will turn it over to one of our ACEs subject matter experts, who's also involved with Reach Out and Read Illinois, Dr. Kristen Keenan, to introduce our speaker today.
All right. Good afternoon, everyone. It is my absolute pleasure to introduce Dr. Amy Shriver. She is a general pediatrician at Blank's Children Pediatric Clinic and an associate professor of specialty medicine at Des Moines University. She earned her medical degree from the University of Iowa Carver College of Medicine and completed her pediatric residency and chief residency at the University of Colorado, where she served as a pediatric resident advocacy director. Dr. Shriver serves as the president of the Iowa chapter of the American Academy of Pediatrics and is the medical director of Reach Out and Read Midwest, where she leads regional efforts to integrate early literacy, promotion, and relational health into pediatric primary care. Her work focuses on advancing trauma-informed care and strengthening the role of pediatric practices and addressing the social drivers of health. Through partnerships with organizations including Iowa ACEs 360, Prevent Child Abuse Iowa, Sesame Street or Sesame Workshop, Polk County Public Health, and NAMI Iowa, Dr. Shriver works to translate research on adverse childhood experiences and relational health into practical strategies that help clinicians support resilient families and thriving communities. And without further ado, Dr. Shriver.
Hello, it is such a thrill for me to be here, and thank you so much to Abby and Kristen and everyone who has invited me here today. I know I'm in good company with the other two experts that you have invited to talk about ACEs and relational health. Today my goal is to help you review some of the things you have already learned with if you attended the other lecture series about what are ACEs, what are the impacts of ACEs on early brain development, and how does that continue on to potentially affect lifelong health, to analyze the importance of relational health and positive childhood experiences on adult health outcomes, to help identify the role of pediatric providers as relational health interventionalists. So I like to think of us as actually doing good, not just doing referrals for good, and integrate early relational health strategies into pediatric practice. So first, I want to start off with this beautiful quote that I think summarizes many of our lives. Life is amazing, and then it's awful, and then it's amazing again. And in between the amazing and the awful, it's ordinary and mundane and routine. So breathe in the amazing, hold on through the awful, and relax and exhale during the ordinary. That's just living heartbreaking, soul-healing, amazing, awful, ordinary life. And it's breathtakingly beautiful. So I think we can all relate to the good and the awful, but I think we don't often reflect very much on the routine. And that's part of the beauty of relational health, is that the routine things we do every day are the magic that helps us become who we will become. So at first, I'd like to introduce someone else who it plays a huge role in my education and knowledge about trauma-informed care and relational health. And this is Heather Forkey. So if you haven't met Dr. Heather Forkey, I suggest that you do. She is an expert in trauma and often in pediatrics, and often will give lectures at national organizations. And she's inspiring to me because she loves mnemonics. And so she creates a lot of mnemonics that help us remember how to take care of children who've experienced trauma. And so I created a mnemonic to Heather Forkey. She is my favorite orator regarding key educational yumminess. So is it a good mnemonic? Maybe not. I also want to inform you of some of my other passions that sometimes seep into my lectures. One cool thing about doing PowerPoint is that you can literally put anything you want on a PowerPoint. So I will be including more mnemonics and possibly information about 80s music. Inventing new words is something I like to do. And then Steve is the name of my Chat GPT guy. So he will appear in a couple of slides as well. I don't know if you've named your Chat GPT or not, but I also want to shout out to my friend and colleague, Dr. Mariana Glusman, former Illinois AAP president and the medical director for Reach Out and Read Illinois. Dr. Glusman and I are good friends and colleagues, and I like to refer to her as the CEO of joy. So hopefully this lecture is a lot about joy. So it's very much inspired by my friend, Dr. Glusman, who couldn't be with us today. So now, talking about inventing words, I wanted to describe a word that would give you the feel of how it feels to like have a revelation happen, like when you went from being in the dark to being in the light. And so when I first started learning about early brain development in children, it was a bunch of astounding fundamentia. It's astounding, and it's an aha moment that you have where you're like, this so makes sense to everybody, and it's fundamental to our understanding of ourselves as human beings on this planet. So Steve and I invented the words astounding fundamentia. This is just things we should all learn as we grow, because it helps us understand our existence on the planet, our relationships with each other, and kind of some of our goals growing up as we become adults and then as we parent the next generation. So let's talk a little bit about this astounding fundamentia. First, this is a review of things that many of you may already know, and if you are a practitioner like I am, you may already incorporate it into the work that you do. First, we know that early brain development, we're born with trillions and trillions of neurons, which start making connections rapidly right away after we're born. So in those first 1,000 days of our lives, we have a very sensitive period where our brain can proliferate and has the potential to grow extremely strong, extremely rapidly. It is based upon our experiences and our relationships. So when we are exposed to positive experiences, our brains can grow in a positive, strong way. And when our brain is exposed to a lot of great strong relationships, our brains can also thrive and grow. This is also a very vulnerable time. Our brains are vulnerable to our environments as well and our relationships. So when relationships are strained or stressed, or just not going well at all, or if our experiences cause us strain or stress, that's going to change the way our brain develops and adapt in a different way that may down the line not be so good for us. So some of those experiences that children may have in the earliest years of their life are referred to as ACEs, or adverse childhood experiences. And many of us are familiar with those. Well studied in the late 90s, early 2000s are these 10 ACEs that we commonly refer to, which include physical abuse, emotional abuse, and sexual abuse, physical and emotional neglect, and then those household dysfunctions like severe mental illness in the family, incarceration of a family member, domestic violence at home, substance abuse at home, and then household challenges such as divorce, separation, or just kind of a lot of arguing at home. So those are the 10 that we are most familiar with in the research. However, over the past 20 to 25 years, research has expanded into the community-based and environmental ACEs that we know about, or social ACEs, as some refer to them. So things like not having four walls or a steady place that you call home, not getting enough food, living and moving from home to home, or being in foster care away from your bio family, community violence, medical stressors, racism, discrimination, and cyber stress can all contribute, as many other ACEs can. So the way that I often think about ACEs or toxic stress is this is poison to our bodies and brains. So if we experience a lot of ACEs and they accumulate, more ACEs, the more stress we experience, and we don't have the power of buffering relationships, this can cause toxic stress, which can be very toxic to our body and brain. So how does this come out in well visits? How does it show up? So we can see that stress, toxic stress, has many impacts on the body, including your brain, your cardiovascular system, your joints and muscles, your immune system, your skin, your gut, and your reproductive system. And over the past 19 to 20 years of my working as a primary care doctor, I see this coming out, for example, in this 6-year-old who may present to my office with abdominal pain times 2 months. And you can look and look and look for reasons for that abdominal pain, and sometimes you won't find a physical cause, but you'll find that this is a somatic symptom related to stress. This 6-year-old might present with 2 months of a poorly controlled cough. They may have underlying asthma, which is just really difficult to control because the body's immune system is on overdrive, and it makes chronic illnesses difficult to control. Sometimes it's a total oral rehabilitation that you see coming in. This can have a lot to do with a family's access to resources, leading to poor dental health. And if you know a family doesn't have what they need, oftentimes that is a stressor that we can see showing up in the form of dental decay. Then our 6-year-old might have recurrent ear infections over and over. Again, if your immune system is affected by stress, that can cause, recurrent infections, recurrent inflammatory conditions. Or maybe the 6-year-old comes in with behavioral outbursts and difficulty learning. We know that a brain can have some increased reactivity and decreased ability to self-regulate due to stress. And then finally, difficulty sleeping is something commonly seen in the pediatric world because you can't sleep because you're on overdrive and your hormones are causing your fight or flight response to continue. So these are common ways that I see it in pediatrics. We know that ACEs can have effects on the way that we behave. So if you're very stressed out, often that can either be the cause or the result of lack of physical activity. Some will adapt behaviors to self-medicate, like smoking or drinking or using drugs. And oftentimes ACEs will cause or lead to a lot of missed work. You can have effects of stress that can lead to problems with obesity, diabetes, depression, suicide, and many other illnesses that affect your adult life. So we know that there is this pyramid that we often see for uncontrolled toxic stress, which can lead to problems with disease, disability, social problems, interactions with others, and possibly early death. So we know that this can happen if there is some uncontrolled stressful events in somebody's life. So what now do we do about it? Well, I'm going to revert back to the 80s and let you know that really the message is very much about the power of love and how can we bring that power of love to families or support them in their efforts to bring the power of love into play. So turning the page, I'd like to reflect on one of my spirit animals and mentors, Dr. Andy Garner. He is the author, of course, of the 2012 policy statement at the bottom, Early Childhood Adversity, Toxic Stress, and the Role of the Pediatrician. He, in 2012, gave us a way of working towards discovery of toxic stress in our patients, noticing it, possibly screening for it, thinking about it, educating families about it. And over time, what we realized was we really have a bigger role than just identifying toxic stress. We actually can intervene with toxic stress. So in 2021, Dr. Garner wrote, along with his colleagues, Preventing Childhood Toxic Stress, Partnering with Families and Communities to Promote Relational Health. So in preparing for this, I actually emailed Dr. Garner and asked him, I said, what is the number one thing that you tell your parents and your families when you're talking about relational health? And he wants you to know that if you only have one message for your families as you engage in interventionalism, it's about rupture and repair. So he says to you, you don't have to be a perfect parent. You still have to continue showing up and continuing to understand the process of rupture and repair. So sometimes I like to take a lot of technical discussions and translate them for our patients and families. So I have two ways for you to think about Dr. Garner's message of helping people understand rupture and repair. So the first one is called Hurt, Hug, Heal. And that means that everyone is going to experience times where they're not in sync with their child, where there's a hurt that happens, and it's not a physical pain. It's usually just arguing or just not agreeing on things. And when you have that hurt, the next thing that you can do is return after you've had a chance to process your hurt and heal together and, forgive each other. So forgiveness is the magic that makes us heal and makes us stronger. So that's the heal part. Once you have come together and you have either physically hugged it out or at least emotionally hugged out your problem, then you become a stronger human. So that is the process by which we all have interactions every single day. And it's very important that parents realize that it's okay to have those interactions and that indeed those interactions make us stronger. But you do have to complete the circle of the hurting and the hugging and the healing part. So he wants you to know that. You might also call it breaking and remaking, which is a cute rhyming way of thinking that sometimes our relationships just break a little and then you come back and you remake them and they become stronger as you do that. So, and when Dr. Garner gave us the 2021 policy statement, he gave us ways of actually preventing childhood toxic stress and then buffering against more toxic stress. And what is the active ingredient? The active ingredient is positive childhood experiences. So, over the course of the last 10 years or so, we've had a really growing amount of data that support positive childhood experiences as a fundamental way to help people feel safe and secure and loved. So what are PCEs? Well, they're actually those day-to-day things that you do to help your child feel like they're important to you and that you love them no matter what. So a PCE score that people do for adults includes, were you able to talk to your family about your feelings? Did you feel your family stood by you during difficult times? Did your family help you engage in some community traditions or activities? Did you feel a sense of belonging in your school? Did you feel supported by friends? And do you have at least two non-parent adults who really care a lot about you? And do you feel safe and protected when you're in your home? And this study, of course, was the famous study done by Bethel et al. In 2019, and it shows that even if you have a lot of adverse childhood experiences, that these are buffered by the effects of cumulative amounts of positive childhood experiences. So this says that even if you have on the purple line 4 to 8 adverse childhood experiences, if you also have 6 or 7 positive childhood experiences, such as the score on the right, then your chance of adult health problems drops really dramatically. So it protects you and helps you have better mental health as an adult. So this is a very, very strong and important message for primary care providers like me and for families. I went and kind of said, well, what's updated in terms of the PCEs data? And there are so many studies out there that continue to reflect this. So, for example, this study on the right shows that the more PCEs you have, the lower your risk of physical health and mental health, and the lower risk that you have for developing adult health diseases. And so we really want to make strides in public health. So PCEs are actually a big public health intervention. The study on the right is a systematic review of 58 studies that look at PCEs, showing indeed same things: better mental health, better physical health, healthier behaviors. So the middle study actually shows that the more PCEs you have, the higher the chances are that you will get post-secondary education, that you will have a higher household income, and that you will engage in fewer harmful behaviors such as smoking, and that you have a decreased risk of chronic disease. So PCEs are very, very good for your health, as we can see, and are independently associated with better health regardless of your ACEs. So that means that the effects of PCEs are not just buffering stress. It is very promotive of good health to have these in your life. So that means that the more PCEs you have, the better you're going to be healthy, even if you have no ACEs at all. Oops. So just so you know, what are the strongest PCEs, if you're just going to pick a few to mention them in your practice? Safe, stable, nurturing relationships, which we'll get to, are of course PCEs on their own, and a sense of belonging, whether that's a sense of belonging with your community, a sense of belonging at school. All sense of belongings are important. Sense of belonging in your home. And then having a safe community to live, learn, and play is a really critical PCE. Okay, and again, PCEs are scientifically based. We know from Dr. Segi that they build your brain through your ability to explore, try new things, and have new experiences that are happy. That's going to support your learning, self-esteem, and resilience. They also prevent by buffering. They prevent by strengthening families and then reducing your exposure to adverse events. And then they'll buffer toxic stress as well. So even if you have ACEs, which most of us have at least one ACE, it can help then buffer some of the challenges that you experience and promote your health that way. And then it means that you will feel more you'll feel more PCEs when you have more healthcare and more safe, connected communities. So we know that communities play a big role in promoting PCEs. So if you live in a community that you feel appreciates you and takes good care of you, then you're going to have more PCEs and more health. So we do need to appreciate this is not an individual family only. So this message is from my friend Steve, my ChatGPT, but it's really to let you know that PCEs, or positive childhood experiences, are the experiences we have, but they are based in SSNRs. Like, you have to have safe, stable, nurturing relationships in order to have PCEs. So that's how they're kind of related. That your bonding, your physical and emotional safety are the key ingredients to being able to have these positive experiences in your home. So again, the way I think about our policy statements that we have in the AAP and the way that we can intervene is that toxic stress can be a body and brain poison, but that we can prevent toxic stress and buffer it through the medicine or the remedy, which is early relational health. Of course, that's not the only remedy that we need, but it is a very key component that we can actually do as practitioners. So again, what is pediatric interventionalism? How do we put the science of PCEs into our practice? That's what I tend to like doing. So again, promotion and practice of early relational health, modeling the behaviors, using a parallel process to demonstrate those behaviors, and coaching families is the key to helping them with our interventionalism. So I have a picture of Tom Hanks here with Wilson. Everybody remembers that he lived on a deserted island for 4 years, and he couldn't have really survived without Wilson. Wilson was a key relational health component of his life. While many of us think it's kind of funny to see him create this humanoid, he really needed that in order to stay sane and to feel like he had somebody to talk to. So I think Wilson really summarizes for me like the loneliness you feel when you don't have safe, stable, nurturing relationships in your life, because life is all about relationships. So again, defining early relational health, this refers to our capacity to develop and sustain safe, stable, nurturing relationships that babies and toddlers experience with their caregivers. The early relationships build the health, educational possibilities, and social well-being of our children and mitigate the effects of stress. So for this reason, it's important for healthcare providers to center their medical care and relationship building with families around the promotion of early relational health. And this isn't always easy, but it is something very beneficial that will make the practice of pediatrics more meaningful. So again, taking inspiration from our policy statement, we need to be thinking about ways to incorporate universal early relational health, regardless of if you've experienced trauma or not. We need to be integrating this into our primary health and asking what's strong with you. Thinking back to whether or not someone's experienced trauma, trauma-informed care is creating a safe, stable, nurturing environment no matter what. So you don't know who's walking into your office. You don't always know what's happening in their lives. So using universal precautions and using trauma-informed care with everyone is a critical component of effective medical care in the pediatric environment. So remember that we're always thinking, what if trauma has happened to you? What happened to you that created the you that I see before me? Sometimes what happened to you was mostly good, but usually there's also some stuff that's not so good. So we have to figure that out together, and we have to then work towards a healthier future together. So we want to use your past history as a way of understanding you and helping you to promote safe, stable, nurturing relationships within our exam rooms, like I'm in right now. So again, the key components that include both trauma-informed care and relational health are safety, creating a safe space for our patients and families, trustworthiness, empowerment, and allowing a lot of choice and collaboration in our discussions, with a high focus on relationships. So talking about the importance of safe, stable, nurturing relationships in the primary context of thinking about trauma, but also thinking about building a future human. So there are several evidence-based in-clinic interventions that everyone should know about. Many of you have heard of VIP, the Video Interaction Project, which is where we have someone that comes in and videos an interaction of a caregiver and child playing together and then reflects back upon all of the positive things about it with the family, therefore building a reflective capacity and helping them understand the power of play and the power of relationship building. So that's a very effective, but not always possible to do interaction. So that does have some financial and time restrictions that not all of us can do. Healthy Steps is a really common and broadly based intervention where there's a specialist that can come in and kind of coach families to embed developmental expertise directly into clinics to help especially new first-time parents build capacities. And so Healthy Steps is also highly recommended and highly evidence-based, but also expensive and not possible to do in every setting. Reach Out and Read is something that all of you should probably be familiar with or have heard about. It's a program that partners with pediatric care providers to hand out books and also advice and guidance on developmentally appropriate shared reading practices within families, working to overcome barriers and strengthen relational health through shared reading. So that's a very powerful and very inexpensive and very scalable model to be doing. And so I hope that many of you are already doing this practice. If you don't have the funding to do to hand out the books, which does cost some money, you still can emphasize reading as you should, because it is in our Bright Futures guidelines for talking to young families about shared reading, and our policy statement that came out in 2024 by Perry Class and et al. About the importance of literacy as part of well visits. Finally, there's a program called SEEK, which I have a little bit more about in my talk, which helps providers identify and address key family stressors through screening and through some in-clinic interventions. All of these have been shown to have positive effects on improving early relational health. So I'm going to skip that. Okay, so So I have several models here of ways that you can think about taking steps to incorporate early relational health in your practice. So I went to the literature and I'm like, where do they have a step-by-step process of how I would do this in my clinic? Surely someone has come up with a bunch of steps that help me do this, so I'm not making it all up. So the American Academy of Pediatrics has a trauma-informed care-based strategy for becoming aware of trauma, preparing your clinic for being ready, finding ways to assess trauma, and then how to manage it and integrate it. Well, I'm not really going to talk about that today. The SEEK model I discovered has an acronym called REAP, which you can reap the benefits, I suppose. So that can be helpful. And that is in clinic, talking to families, reflecting on their experiences, empathizing with them, and then assessing and planning. So I liked that one okay. And I think that one could be very useful. And then hopefully I created my own. So I'm like okay with creating my own strategies that are acronyms. So you can decide if any of these work for you. But mine is called Be Nice because that is easy for me to remember. I am pretty nice every day to my patients. So being nice means that we should notice things in the room. Notice them as in terms of kind of being reflecting and assessing and being aware as these other strategies have, but also noticing them out loud to the family. So you may notice how the relational health is going in the room, and you can have some comments about that. And then you're going to be able to sometimes identify the strengths and identify some of the risks or challenges that are going on in the family. And then send out your core messaging about relational health and provide some supporting education in various forms. So we're going to actually walk through that together. Let's start with my friend Jaden. Jaden's a 3-year-old who comes in, and mom has a concern about Jaden is that he has some behavioral issues. He is very big about throwing tantrums. He gets triggered a lot for big feelings and often will just throw himself on the ground, and mom's not really sure what to do about it. He might sometimes in preschool hit some other people in his preschool class because he doesn't know what to do with himself. And teachers are really fed up with his behaviors and they're threatening to expel him, and mom is kind of beside herself. So you actually have done some surveillance in the room and have discovered that there are some signs that there may be some maternal depression, that there's food insecurity in the home, and that there's financial insecurity in the home. So good for you for checking for those things, which have a big impact on families. And then you've also done some developmental surveillance and screening, identifying some expressive speech delay for the child. You've done a review of systems that's indicated that he's had some constipation, which is pretty common, as we all know. And then your exam, he's kind of hyperactive and all over the place. He has some eczema, but otherwise he has a normal exam. So now we're going to take our Be Nice strategy and we're going to notice some stuff. And we're going to notice some of it in our heads and notice some of it out loud. And we're going to watch the caregiver-child interaction. Sometimes you'll get feedback from the caregiver-nurse interaction too, which I find very helpful in understanding families. So we notice that mom and he are not like sitting together and cuddling. They're not looking at books together, and they're just kind of, there's a little bit of tension. But you might also be able to notice things that are positive when you're in the room. So say them out loud. Like, I notice how when he gets nervous, he's looking to you and reaching to you for comfort. And that's really important. It shows that you're his safe space. So you're commenting and offering these ideas that being a safe space is really important. You also can say, I notice or I love how you picked him up when he looked scared. So you're re-emphasizing some of the positive behaviors that exist in the room, really getting mom to notice as well that she is doing some things very well. But here's what you see is that Jaden's playing on his mom's phone. He's not really looking at her. He's jumping around on and off the table. He is climbing around asking for toys. And then his mother starts getting angry and starts yelling at him to sit down. So now that we've noticed some things and walked through some things with mom, we're going to think about identifying risks and protective factors. So when we think about that, I have learned from R.J. Gillespie, one of the relational health experts in in Oregon that taking a relational health history is part of our history taking. So ways to do that, what are we actually looking for? Relational health components include caregiver mental health, social drivers of health, and caregiver trauma history. Some of those are really challenging to ask about. So it's helpful to have some phrases that you might like start with. So I ask all families a few questions like this because it can really affect kids' development and behavior. Is it okay if I ask you a couple questions? So you can hear that that starts opening up some motivational interviewing by saying, is it okay if I ask these? Well, they don't actually know what you're going to ask, so chances are good they'll say yes. But also just to introduce it because I'm not asking for any reason other than it can affect how kids behave. So I hope it's okay that I ask a little bit more about some pretty personal things. So taking care of a 3-year-old can be a lot. How have you been doing? Do you have any concerns about your own health? It's great. That shows that you are paying attention to the whole family and that you can, if you discover some concerns, address those, which will greatly affect the outcomes. Social drivers of health. We asked those already in our surveillance, but have there been times where it's hard to make ends meet or get your family what they need? That's important in today's economy especially, but for all families that we serve, we need to have an idea of if they have enough or if they don't have enough of something that's critical. And then caregiver trauma history can be tricky to ask about, but you can just have a reflective question. Are there anything from your past that make parenting more difficult or challenging? And that's a great question that's open-ended and gives families an out if they're not ready to share, but also can have them be reflective upon their past history and maybe does it have effect on their parenting? Sure, it might. So as we identify those risks and protective factors, taking the history, asking questions, normalizing challenges, making sure that we are listening and walking the walk with the family, but that it's okay to have like challenges in your life because everybody does. Validating the feelings. I had a 3-year-old who was what I like to call a Sour Patch Kid. So anytime I see a 3-year-old who's like behaving, I'm shocked. And then be curious and non-judgmental. If you are curious and non-judgmental throughout, your parent will feel safe. And if a parent feels safe, that's really the only way to create a trauma-informed care scenario. We did identify some concerns there with those social drivers of health, with maternal health concerns. We also saw some relational health concerns with the kid and the mom not being attuned, which, happens sometimes in our exam rooms. There was some yelling that happened and just kind of taking a look to see if, people are, we are screening them for what the comfort level in the room. But we did notice some protective factors as well. Mom is very interested in helping and figuring things out. And then we also found out that there are some family supports involved too. So when we're kind of assessing, when we're kind of figuring out risks and protective factors, you can do what we did here, which is ask open-ended questions. Or you can use some more tools, and there are so many tools in the toolkit. So one tool that you might be familiar with just comes from Bright Futures. And if you haven't seen it before, it's obviously got a lot of questions. So that's going to be a time commitment for those of you who haven't used it yet. But the pediatric intake form does check a lot about family history, health habits in the family, and then it does a little bit of parental ACEs screening. When you were a child, what did you experience? And then it also has some of those protective factors involved too, like did you have help and support? Do you have help and support right now? So these are important questions. We're not asking just for fun, but we actually would probably use a lot of these questions to make a trauma-informed health history. So this is a really great tool that's free and part of Bright Futures to use. There are other screening forms that you may choose to use or not use. For infants and toddlers, for example, the pediatric symptom checklist is something that we use, and we actually use it in the 9-month-old SWIC. So when we're screening kids for behaviors and development at 9 months, we use that one. But there are many others to be used. In school-age children, you can use the pediatric symptom checklist or some anxiety screeners. Strengths and difficulties questionnaire is a popular one to use. And then in adolescents, we are, per Bright Futures, using something like the patient health questionnaire at every well-child visit, but there are other strength and difficulties questionnaires that can be used as well. I mentioned that SEEK program has special tools for us to use. So as part of the SEEK program, if you have suspicions that there's some harsh punishment going on, there is an actual tool that helps you screen for that. And so you can pull that out and use it. And it kind of takes you through some dialogue. Hey, do you feel your child is difficult to take care of? Do you want some assistance in taking care of your child's feelings or behavior? So it's a very empathetic way of going through possible harsh punishment questions. What about ACEs screening? Just briefly letting you know, ACEs are common life adversities, and they're strongly linked to poor health. And that current evidence on screening is that some people have been screening. It was very popular, especially kind of in the early 2010s, to do some screening, but there's not a lot of evidence that it improves patient outcomes to screen. There can be potential risks to doing straight up screening with an ACEs tool only, which can be increasing stigma or re-traumatization, unclear plans for follow-up, and there's a risk of bias in these screening tools. Also, some of the screening tools were designed for research and not designed for actual patient care, so don't always measure what you think they're measuring. There are some benefits to doing ACEs screening too. So even just mentioning ACEs allows families to understand the impact of ACEs on trauma. Some patients don't know how much their past experiences have affected their lives right now, and even knowing that can begin the healing process. It can create increased bonds between you and the family for that disclosure of those very personal things that happened to them, and an opportunity to offer support because, hey, you listened and someone heard and they can help you heal. So those can be. However, most of us, the recommended approach from the AAP is that you don't prioritize ACEs screening, rather you prioritize trauma-informed relational care with a focus on safe, stable, nurturing relationships, using conversations, not just screeners, make it personal, make it more relational, and ensure that if you do any sort of screening or questioning that you have resources for those questions that you ask. So if you're going to ask about food insecurity and you get a positive response, that you have some resources for the family, for example. ACEs do matter, but again, the ACEs screening that traditionally has been used is potentially not the best thing to be using. So going on and on about identifying risks, this is what you ask. Hey, what are some things that you love about Jaden? So you're going to start with the positives because protective factors first. Mom says, well, I love it when he gets tired out at the end of the day, he will finally settle down and I get to snuggle with him, and that's my favorite time. So that's a really positive thing. And then what are some things that make parenting challenging or stressful? And mom's like, well, I don't think I'm parenting him right. I think I don't have what it takes to parent this child. So that was a really important thing to learn, that she's afraid. So again, we screened and we identified these risks that we already talked about and the protective factors. She loves those snuggles. She is worried, and so we need to kind of support her in that space. So now, since we have done the N part by noticing, we've done the I part by identifying risks and protective factors, now we're going to do some core messaging. It sounds like it can be really difficult to parent Jaden. Is it okay if I teach you some techniques that have helped other people? That's my motivational interviewing question. And then also reaffirming and kind of empathizing with her. So now we're going to say our core message, that strong, positive, or safe and stable nurturing relationships can help young children learn to control their big feelings. Relationships are medicine for him, right? So it's not just, it's a good idea to be kind to your kid, but that the relationships that you take the time to do are the medicine that he needs to help control his big emotions. That's important to know, that the parent is giving medicine and the medicine is relationships. You might notice here that I have said strong positive nurturing relationships. According to some of the research that David Willis has done with nurturing connections, they worked with a lot of focus groups, and parents actually resonated better with strong positive nurturing relationships rather than safe, stable nurturing relationships. So just to confuse everybody with terminology, you might decide to adopt strong positive nurturing relationships because parents really like that. So here's another positive message. You can build your relationships over time through just extraordinary, ordinary moments. So parents don't know exactly how to build relationships. A lot of them need more tools in their toolbox. So here are some core messages that are easy to give that kind of resonate with a lot of families. So unforgettable, forgettable moments, just the daily things that you're doing every day that are really positive for your child, like singing to them, like tickling their feet when you're changing their diapers, like just picking them up and giving them hugs when you see them in the morning. Whatever those little things are, those are called unforgettable, forgettable moments. A kid might not be able to tell you if he got hugged in the morning, but it embeds in his soul that he's important and that he is loved. And so that's how unforgettable it is that the body remembers. Extraordinary, ordinary moments. That emphasizes to families that this doesn't have to be well thought out or really planned or some big, huge thing like a party, that these ordinary moments of love and care that we show our children every day are the magic that helps them become healthy humans. So caring connectedness, that can emphasize the fact that you're demonstrating that you care about the child and that you're connected and attuned to them. And then mini moments that make us, that helps emphasize the fact that these do not have to be grand gestures. These are just little things we do, like saying, hi, I'm glad to see you this morning. Something little like that, or that hug made me feel great. These are just little things. You don't have to do big things every day. So I mentioned to you that I spend a lot of time building this as a program for my patients. So in 2023, I developed what's called the Iowa Pediatric Project, or the CARE Project. And inside that, I created a mnemonic called Bonding with Your Child. If you are a new parent, if you didn't have the parenting skills because you felt like you weren't parented well, you might not know when or how to do some of these safe, stable, nurturing things in your home. So bonding tells you when to do them. You can do them anytime, of course, but if you do them at certain times, they're already built into your schedule. So a lot of times, bedtime and bath time are times where you have to be with your child, or somebody has to be with your child to make sure that they are clean and sleeping. So bedtime and bath time are part of bonding. You can make those into fun activities where you do shared reading practices, or you play with little ducks in the bathtub and make them giggle and laugh, and have them remember the goofy things that the ducks did. So bedtime and bath time, really important times where you can do bonding. Outside time, that tells you a lot. Like, your kids, if they're little, should not be wandering around outside by themselves. They need an adult to watch them. But also, it's a great time to spend time outside, which is very healthy for kids. So it emphasizes not only the relational part, but also being in nature. Nutrition time, obviously a great time to feed your child and model good nutrition for your child, but also goofing around with your child. And there's some data later on about family meals that can emphasize some of the science behind eating together. And then driving time. Please don't crash your car. Please don't be distracted in your driving. However, you do have a captive audience with a child that's in a safe car seat. So that's a great time to sing together and listen to stories together and play little games together, or just chat. So driving time's another great time to spend time together for busy families. So when we kind of create a plan, we're doing education. And as pediatricians, we have a lot to do in a well visit. So you do not have to do all of these things at one time. You're going to select some of the things that will make sense for your family in their scenario. But you want to have some go-to early relational health advice that you can pass along, or education. So we can talk about some of these as we go, but there are some in-clinic interventions that'll work really well for him, including the good enough parent talk, how to talk about parenting styles, something I will get to called Q-tipping, catch them being good, incorporate time in routines, and then establish these healthy routines like shared reading will really help this 3-year-old. Sometimes we will need to do other things to help support. So it's not always just the only thing we need to do, but thinking about occupational therapy to give mom an idea that there are others who can support him with his difficulty with self-regulation. He might benefit from some parent-child interaction therapy or behavior management therapy to help the parent kind of parent around some of those difficult behaviors. Maternal mental health may be good for this family if she's experiencing depression. She might be misinterpreting cues or having some of her own feelings interfere with relational health. Social work might be helpful for some of those social drivers of health we saw happening, and thinking about ways we can get families enough food if they're experiencing food insecurity. So how does relational help this mom? We're going to help Jaden buffer some of the stress he may be experiencing through some of the things like food insecurity. And those PCEs are going to proactively help him grow and promote his executive function and self-regulation skills. And then with Jaden's mom, we're going to be curious and non-judgmental, and that's going to help build trust and reduce her own shame and help her feel safe. So we're going to reinforce that safety and regulate mom's stress response in doing that. And then we're going to build mom's reflective capacities and build her self-efficacy. And so I like to think of self-efficacy, that's the I know I can do it feeling. I like to think of it more as building confidence and competence. And a confident parent is a parent who is less afraid and who's able to parent without as much fear-induced yelling. Okay, so here we go. These are some of the tools that I was hoping to get to, so I hope I still have time to get to them. I think about my tools in age groups. So when I think about the 0 to 1 month age group, I have several things that I use as interventionalism at that time, realizing that you can't spend a ton of time with new parents because their brains are already overloaded with all of the things you need to do as a new parent. One of the things I emphasize is skin to skin, and I let them know that there is a chemical reaction between your skin and your baby's skin that helps coordinate brainwave connectivity, heart connectivity, and if you're breastfeeding, it helps with that breastfeeding connection. So I really emphasize the most skin-to-skin contact possible to help with relational health. And then in doing that, I also talk a little bit about biobehavioral synchrony. So as we know that when you become a parent, your brain becomes the most evolved brain of all human brains. You have a new capacity for empathy as your brain starts to sync with your baby's brain. Your heart rhythms start to sync with your baby's heart rhythms. Your hormones will sync with your baby's hormones, and your behaviors will sync with your baby's behaviors. So all of knowing that as a parent that you have changed as a human being is really impactful and important. And sometimes as a parent, you can talk to non-parents and they just don't get you. They don't understand all the ups and downs. So it makes a lot of sense. It's a lot of times I'll emphasize that this age range is the most formative time for a child. So that interactive back and forth serve and return is so critical starting now so that parents don't wait. And then sometimes they need to hear a little bit about swaddling their baby and comforting their baby in those first few weeks. So I will talk about that. But I do want to talk to you about some of the tools and about the promise. So the promise is something I've started doing in my clinic because of the lack of trust I have seen coming into my clinic lately. There have been some outside influences that have affected the relationship between doctor and patient in the pediatric realm. You may have noticed some of those. So what I've started to do is become proactive in my interactions. And Dr. Glusman and I are actually working on a book that describes this to families. But what I do is, you can see, I give this child a heart-shaped teething ring at the very first visit. Usually they're too young to have teeth at the visit, but I still bring in the ring. And I say that I am here to make a promise to you and your child. And a promise is often reflected by a ring. And this ring represents a promise that I will listen to you and I will give you the best guidance and the best advice, evidence-based advice I can to help you make the best decisions about your child's health. And that's all I say, but it does help families feel like it's a safe and trusted place, and it helps open the gate to further questions, and it also models some of that parallel process, which means if you are creating a safe trusted place with the parent can create that safe and trusted place for their child. As you know, Reach Out and Read starts at birth, and it is an evidence-based, effective in-clinic intervention in which we give advice to families starting at age 0. So I will, of course, come into this visit with a book, and I will talk to the family about how sharing books and reading elevates your baby's brain, creates new important connections, and creates bonds between the two of you that last a lifetime. So whatever short conversation you need to have at age 0, start talking about books right away. And then moving on to kind of the older infants, there are a lot of things that will be part of your interventionalism, including just counseling them about what to expect in terms of normal development, serving and returning interactions back and forth, the bonding we already talked about, responsive caregiving, which means their main job is to listen to the cues that their baby sends them, creating routines around certain things like eating and sleeping, which will help them feel safe, making sure that caregivers themselves have the support they need during this challenging time. And then I talk a little bit about shark music. I do want to make sure you're aware of some of the tools out there that you can use to incorporate and hand out to families. So milestones are really helpful for parents to feel capable and confident about their child's abilities. More talk about Reach Out and Read. Mount Sinai Keystones is a great resource that has handouts for families at every age about how to play with their baby and understanding their baby's behaviors at each age. Sending them to libraries, of course, is a great resource. And the AAP has a new early literacy toolkit, which has resources for you about shared reading at each age. So what is shark music? And this is something important for everyone. If your toddler or your older infant is crying and it sets something off in you, if their behavior makes you feel just really scared and you feel like yelling, to recognize that that's something that the circle of security calls shark music. It's sort of like makes you remember something from your early childhood, or just really sets your emotions on edge when you hear it. And so it's sort of like the noise of jaws coming towards you with that na-na, 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 na-na. That's the shark music that you hear. It's something that makes you feel scared. And if you can recognize that emotion within you when you have your baby behaving a certain way, then you can control your emotions and put your lid back on, and then try to maintain that calm demeanor that your child really needs you to do. So learning to recognize your own triggers, the things that really set you off as a parent, and helping to control them will help you parent better. So shark music is something that I use in early relational health. For toddlers and preschoolers, there's so much advice that can be given because this is the age at which I feel like parents really need the most support with parenting. So I'm going to go over several of these. One is to discuss parenting styles. So when you see parents who may struggle with helping their child follow directions and learn important things at home at the ages of kind of 1 through 6 or 7, then talking about the authoritative parenting style can be very helpful. And drawing this little picture of an arrow that shows high or low responsiveness and nurturing versus high and low, I don't like to think of it as demandingness, but like creating boundaries and safe rules at home. So if you have a high level of expectations and a high level of nurturing, then you're in the corner we want you to be in most of the time. And that's the corner where kids feel safe because they have rules at home, and they're learning how to be responsible adults. They also have that feeling of being securely loved unconditionally. So that combination tends to be the most successful. So I always counsel them about the 4 different parenting styles. I do talk about Q-tipping a lot of childhood behaviors. So a lot of times parents will nitpick and really criticize every single behavior that their young child has. And I like to think about Q-tipping a lot of these behaviors. So what does Q-tip even stand for? Quit taking it personally. Is your toddler being a toddler? Do we expect anything different? No. So it's okay to ignore a lot of the behaviors that kids do and be like, hey, they wanted toast, so I gave them toast, and now they're freaking out about the toast. That's a toddler behavior. So you can kind of take a step back and take a breath and realize that your kid's just being a toddler. So try to not get involved with every single little behavior and let them do some of their normal toddlery things without getting too upset. Another thing is to give parents perspectives using the 7 R's. So the 7 R's are a Shriver thing that teaches a lot of families about how to help their toddlers become good toddlers. And so one of them, the first one is the blue one, revel. Revel in your child's fun and their child's beauty and their cuteness and everything. Make sure to celebrate the good things about your toddler. Respond to your toddler. So listen and figure out what they're trying to tell you. Even if they can't talk yet, they're sending you messages. They know what they need, and you're trying to respond to those. Reward them for good behaviors. I don't mean spoil them, and I don't mean bribe them. I mean, if you see them being good, tell them what behaviors you really like that they're doing, and let them know that they make you feel happy and warm every time they sit on your lap. Let them know the good things that they're doing. Redirect. So again, toddlers are not always going to be up to innocent things all the time. Sometimes they're trying to get into stuff. You have to steer them to a different behavior. Role model good behaviors. So if you want your child to be kind to your child. If you want your child to be responsible with your child. Be respectful with your child. So model the behaviors you want to see in your child. Recognize your own stress. And if you're not in the mood to deal with a bunch of toddler nonsense, you might need a timeout, parent. So just take your time. Take a big breath, go find yourself a timeout corner, and then try to remain calm. So these, again, sometimes I add an 8th R in there, routines, but you can't remember more than 7 things. So these are the 7 R's that I like to use to talk to parents about the ways to think about a toddler and how to help them. I also like to talk about a developmental bike. So a lot of times parents will punish kids for being toddlers, right? So if they start to scream or yell or throw themselves on the ground, they're telling you something, they're communicating. But a lot of times parents just consider it naughty and they'll do things like spanking or harsh behaviors. So what I like to say is, remember that your toddler is learning about their big feelings and they're learning about how to express their emotions. And when you're learning something new, you don't need to be spanked. You need to be helped. And so remember, we're teaching them. We are not punishing them for normal toddler development. So think about them when they fall off, when they're having a tantrum, think of them as falling off their developmental bike. And your job is not to punish them for falling off their bike. It's to pick them up, dust them off, and show them how to do it better. And so just the mere analogy of being on a developmental bike helps families understand that they're not being naughty. They're just being kids learning a new skill. I also like to talk to families about stress. My CC123 mnemonic started back during COVID and was really well received by parents. And it's a positive, strengths-based way to talk about parenting during stress. So what I say is stress is real and stress happens all the time. The CC stands for how you deal with stress. Do you have connections with other people as a grown-up? You need to not go through stress alone. Well, your child also needs to feel connected during stress. Second of all, do you have coping skills as an adult? Some of us cope with stress by exercise or taking a bath or something else. Kids need coping skills too to help them deal with stress. And one of the best coping skills is routines and rituals like shared reading, which can really help kids feel safe. Then 1, 2, 3. As a parent, when your child is acting stressed, it might stress you out, but take one moment, just take a moment, 1 moment to try and decode what they're telling you with their behaviors. Just stop and reflect. Also, take 1 moment to forgive yourself because stress means that you're not always your best self. So that's a moment of self-forgiveness. Parents love that one. Then 2 eyes for seeing and 2 arms for holding. This is a way for you to connect with your child through physical affection. Many kids love that. Not all kids love that, but if your child needs physical affection and attunement, make sure you include that. And then 3 is a way of reflecting as a parent. What are 3 ways you can show your child you love them every day? And in older kids, I will also ask the kids, what are 3 ways you can show your parent you love them every day? So that tends to make people feel very happy in my clinic and give them some hope about ways to connect further with their children, even during stress. Often, and I won't be able to discuss all of these because there's too many, I discuss the hand model of the brain to explain to families that when your child is stressed, their cortex or their thinking brain pops open, and they're in their limbic emotional brain. And frankly, a lot of times they'll zip right down here to their brainstem or their survival brain. And if they're right here having a tantrum, not even Santa Claus can fix what's going on here. So this is a time to let them kind of go through their upset cycle. But if you're in the limbic system part right here where they're emotional, that's a time to teach them how about their big emotions. And then when they put their lid back on, that's the time to praise them for being able to control their big feelings. So this hand model comes in very handy. Finally, people need to know about being a good enough parent. You need to know that you don't have to be in sync with your child all the time. This is what Dr. Andy Garner says. Being out of sync is normal. You only need to be in sync about 30% of the time to be a good enough parent, and that is such a relief. The rest of the time you're working on the rupture and repair, and so that breaking remaking cycle is pretty common and pretty frequent, but remember to do the remaking part. So school-age kids, it's important to spend time doing things like assuring them that they're loved unconditionally. So Dr. Amy King has an exercise to do with school-age kids in the car where you're like, I love you no matter what. Let's test me. Even if you slash my tires, I'll still love you forever. I might get really mad at you and make you pay for the new tires, but I'll still love you. Even if you take the table and like crash open all the dishes, I'll still love you, but I'll be like, what is wrong with you? But I still love you. So that game gives kids the feeling that they're always loved no matter what, which grows them into healthy grown-ups. And making sure that parents spend time with their kids through time-ins. Sometimes I include a word like worth wounds to let people know that if kids are getting yelled at too much, their self-esteem will have some wounds. They'll be wounded and they won't trust themselves. They won't believe in themselves. So really re-emphasizing the fact that your self-esteem is a really important part of your health to really keep lifting kids up so that they don't experience all those worth wounds. And then always give your child a soft place to land because they need to come home from a rough day at school, especially like middle school, just to know that there's a safe place for them to be. And then just roses and thorns, you may have heard of these, but this is a major part of like coming home, getting picked up from school, or you can do roses and thorns at dinner time. But like giving a kid a chance to express something good that happened to them during the day and something bad that happened to them during the day. And that's a great listening time that parents really crave, and it's a great way to understand what your child's going through. And so I love you no matter what. And then tweens and teens, there's so many things to talk about. Do continue to Q-tip your teens. They're going to behave like teenagers. So just, don't take it all so personally. I do like to talk about health, making sure that they understand that your health very much depends on these 7 things: good relationships, sleep, nutrition, exercise, taking some relaxed time for yourself, going out in nature, and making sure you're checking in on your mental health. This has to do with eating healthy, exercising, and not drinking too many sugary drinks, and watching your screen time. And then shared family meals, which cannot be overemphasized. Creating shared family meals has a lot of evidence to say that it increases positive social skills, school engagement, self-esteem, and fitness. And it decreases disordered eating, substance abuse, violent behavior, depression, physical aggression, and oppositional behavior. So eating together is highly valued. Get those screens out of there, look at each other in the eyeballs, talk about your day, and you'll watch the magic happen. I do also talk to them about the 3 keys to middle school. Getting through school is tough. You need to have 3 things for sure: your family to support you, your friends to support you, and then some activity that makes you feel a sense of belonging and that drive to succeed and push yourself. So those are things that you cannot go through without. If you are missing one of these 3 elements, then you will probably not be successful in middle school. So those are 3 things I always talk about. So finally, if you are thinking of adding tools to the toolbox of parents, there are parent-facing tools for young kids like Sesame Workshop. The Vroom app is really popular. The Greatest 8 is another app that stimulates great interactivity with kids and parents, and Sparkler, which I don't really know much about, but is highly acclaimed as a way to engage kids in early relational health. I, as a provider, will hand out things from AAP oftentimes. Reach Out and Read has handouts, and then Mount Sinai Keystones has handouts. And then some screening tools are also very helpful. And the AAP Star Center has a variety of screening tools if you want to add to your screening repertoire. So in summary, early brains are astounding. I love an early brain. That's why I do what I do. And hopefully that's why you do what you do. Serve and return is a key component. That early relational interactions that we do every day are the key components to health. ACEs are common. Young children are vulnerable to toxic stress. Toxic stress is like brain and body poison. And the remedy to that, or one of the remedies to that, is relational health, which can be accomplished inside the exam room. So interventions are horizontal and vertical. We didn't really touch on that today because of time, but that means that you want to think of them not only in the pediatric realm, but across sectors in your educational life, in your home life, in community settings, and in social justice settings, so many different settings. And then think of it as vertical as well, which means primary interventions for everyone, like we talked about today, secondary interventions like therapies or medicines, and tertiary interventions as well. And then finally, pediatric care providers are interventionalists. The things that we say and do in the clinic, including things like Reach Out and Read or other interventions that I mentioned, do actually strengthen parents, can make a difference in that child's life and in the parent's life. So that is my final slide. So this is my little group of unicorns that I have here. Here are my references, and thank you very much, guys.